What if I told you that the knee pain you've been managing, working around, and quietly accepting for the past few years isn't actually coming from where you think it is, and that the way most people over 60 respond to it is making it measurably worse? I've been treating patients with knee arthritis for over 2 decades, and the pattern I see most consistently isn't people doing too much. It's people doing nothing. Because they were told to rest, told to be careful, told that at their age, this is simply what joints do. That advice is outdated. And for many of my patients, it cost them months, sometimes years, of mobility they didn't have to lose. In the next several minutes, I'm going to show you 5 specific exercises that I prescribe to my own patients with knee arthritis. Not general movement, not vague suggestions. 5 targeted, evidence-based exercises that address the exact reasons knee pain develops, persists, and gets worse after 60. Your knees are not finished. But the window to act on that is narrower than most people realize. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Exercise 1. Quad set with activation cue. Wake up the muscle that protects your knee. Here's something that surprises almost every patient I see for the first time. The problem with their knee isn't actually in their knee. Let me explain what I mean. Wrapped around your knee joint, above it and below it, is a group of muscles doing a very specific job. The most important one is your quadriceps, the large muscle running along the front of your thigh. Its job isn't just to move your leg. Its primary job is to act as a shock absorber. Every time you stand up, take a step, or come down a stair, your quad is supposed to absorb a significant portion of that force before it ever reaches the joint itself. When that muscle is strong, your knee is protected. When it's weak, and in most people over 60, it is weaker than they realize, every single movement sends that force straight into the cartilage. That's where the pain comes from, not from your age, from an undertrained muscle. The exercise I want you to start with is called a quad set, and I recommend it specifically because it rebuilds that muscle activation without putting any stress on the joint itself. You can do it lying flat on your bed. No equipment, no floor, no risk of losing your balance. Here's how. Stretch one leg out straight and place a small rolled towel or even a folded pillow just beneath your knee, giving it a gentle lift. From there, press the back of your knee slowly down into that towel. Don't rush it. Think of it this way. Imagine there's a grape sitting right under your knee and your job is to flatten it as slowly as possible without bursting it. That mental image, slow, deliberate pressure, is exactly the kind of muscle contraction that rebuilds quad strength over time. Hold that contraction for a full 10 seconds, breathing normally, then release completely. Do 10 repetitions on each leg 2 to 3 times a day. What you'll notice in the first few sessions is that the muscle feels almost unfamiliar, like it hasn't been asked to do this in a while. That's normal. That's actually the point. You're not just exercising a muscle, you're reestablishing a neurological connection between your brain and a muscle that's been underworked, possibly for years. Clinical research has consistently shown that targeted quad strengthening reduces knee pain and improves daily function. And this is where that process begins. Now, the quad is only one piece of the puzzle, because there's another muscle, one most people never think about, that has just as much influence over your knee pain, and it's located somewhere you'd never expect. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Exercise 2. Heel slide. The one exercise you can do before you even get out of bed. Think about the first few minutes of your morning, not the whole day, just those first few minutes after your feet hit the floor. For a lot of my patients, that's the hardest part. The knees feel thick, almost wooden. The first steps toward the bathroom feel like negotiating with a body that hasn't quite agreed to start yet. Most people assume that's just what mornings feel like after 60. It isn't. What you're feeling has a name, a mechanism, and more importantly, a fix. During the night, when your knee stays still for 6, 7, 8 hours, The fluid inside the joint, called synovial fluid, gradually thickens. This fluid is what keeps your joint surfaces moving smoothly against each other. It carries nutrients to the cartilage, reduces friction, and acts as the joint's natural cushioning system. But it needs movement to stay fluid. Without it, by morning, it's closer in consistency to cold honey than to the thin, easy-moving lubricant your knee needs. That stiffness you feel isn't your arthritis getting worse overnight. It's physics, and you can change it before you ever stand up. The heel slide is as straightforward as it sounds, and that's exactly why it works. Lying flat on your back in bed is perfectly fine. Start with both legs extended. Slowly bend one knee, sliding your heel toward your body along the mattress. Go only as far as you can without pain. You're not trying to reach your full range of motion on day one. You're coaxing the joint. Hold gently at the end of that range for 2 seconds, then slide back out to straight. That's 1 repetition. Do 15 on each side. The motion itself, that gentle bend and release, acts like a pump, stimulating the joint lining to produce fresh synovial fluid and distribute it throughout the space. Within just a few repetitions, most people notice the movement becoming slightly easier, slightly less resistant. That's not imagination. That's the joint responding exactly the way it's supposed to. I tell every one of my patients to do this twice a day. Once right after waking up, before getting out of bed, and once at night before sleep. The evening session prepares the joint for the stillness ahead, so the morning stiffness is less severe over time. If you can't reach your heel comfortably, loop a towel or a belt around your ankle and use it to guide the motion. There's no version of this exercise that requires you to push through discomfort. What we've covered so far addresses the fluid and the foundation, but there's one specific part of the quadriceps, a small, often overlooked section on the inner side of your knee, that most exercise routines completely miss. And weakness there is one of the most common reasons knee pain keeps coming back. Exercise 3, terminal knee extension, short arc quad. The exercise physical therapists prescribe most and nobody talks about. Every week I see patients who have been doing knee exercises for months, diligently, consistently, and still can't figure out why the pain keeps returning. They've watched the videos, they've followed the routines, and yet something isn't working. When I evaluate them, the answer is almost always the same. They've been strengthening the right muscle group, but missing one critical section of it entirely, and that gap is costing them everything. Your quadriceps is not a single muscle. It has 4 distinct heads, 4 separate portions that each contribute to how your knee moves and how well it's protected. 3 of those 4 get worked by almost every standard exercise. The 4th, called the vastus medialis oblique, or VMO, sits on the inner lower portion of your thigh just above the kneecap. You can actually see it in people with strong legs. It's that small, teardrop-shaped muscle that appears right above the inside of the knee when the leg is fully extended. In people with knee arthritis, this is almost universally the weakest link. And when it's underdeveloped, the kneecap doesn't track in a straight line. It pulls slightly off-center with every step. That misalignment, repeated thousands of times a day, is a significant driver of chronic knee pain, and it rarely gets addressed directly. This is where terminal knee extension comes in. Sit in a firm chair and shift forward so your back isn't fully resting against it. Place a rolled towel, firm enough to hold its shape, beneath one knee, raising it to roughly a 30-degree angle. From that position, slowly straighten your leg until it's fully extended. The key word is fully. The final few degrees of that straightening motion are where the VMO fires most intensely, and most people never reach them. Hold the leg completely straight for 5 full seconds. Don't rush this, then lower it slowly back down. That controlled lowering matters just as much as the lift. Do 10 to 15 repetitions on each side. What makes this exercise different from a standard leg raise or a basic quad set is precisely that endpoint. You are training the muscle at the exact angle where it does its most important protective work. Physical therapists prescribe this after knee surgeries, after replacements, after ligament repairs, because it works at a level most general exercises simply don't reach. If you have light ankle weights at home, 1 to 2 pounds is enough to increase the challenge once the movement feels comfortable. 2 exercises so far have strengthened the muscles directly around your knee. But here's what most routines never tell you. The real reason some people's knees keep buckling, aching, and giving out with every step has nothing to do with the knee itself. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. Exercise 4 is standing hip abduction with wall support. Fix your hips to save your knees, the connection nobody explains. If you've ever watched someone with bad knees walk across a room, you've probably noticed it without realizing what you were seeing. There's a subtle inward collapse, almost a soft buckle, that happens at the knee with each step. Most people assume that collapse is caused by a weak knee. It isn't. It's caused by a weak hip. And until that hip gets stronger, no amount of knee exercises will fully solve the problem. Here's the anatomy that makes this make sense. On the outer side of your hip sits a muscle called the gluteus medius. Its job is to keep your pelvis level and your leg tracking in a straight line every time your foot leaves the ground. When you take a step, this muscle fires to stabilize the entire lower half of your body. When it's weak, which after years of sitting it very often is, the knee compensates. It absorbs rotational forces it was never designed to handle. The cartilage on the inner side of the joint takes the brunt of it. Over time, that's not just discomfort. That's accelerated wear on an already vulnerable joint. Researchers studying knee osteoarthritis have found a consistent pattern. People with the weakest hip abductor strength tend to have the most severe knee symptoms. The two are directly connected, and treating one without the other is like patching one side of a leaking roof and wondering why the ceiling is still wet. Standing hip abduction addresses this directly, and it requires nothing more than a wall and 30 square feet of floor space. Stand facing a wall, close enough to rest one hand lightly against it for balance. Not to lean on it, just to steady yourself. Keep your back straight, your core gently engaged, and both feet pointing forward. Slowly lift one leg out to the side, keeping the knee straight and the toes pointing ahead throughout the entire movement. Don't let your upper body tilt. That tilt is your hip flexor cheating, and it defeats the purpose entirely. Raise the leg to roughly 45 degrees, hold for 2 full seconds at the top, then lower it slowly and with complete control. The lowering phase is where much of the strengthening actually happens, so resist the urge to let the leg drop. 10 to 15 repetitions on each side, 2 sets. Within 2 to 3 weeks of consistent practice, most people notice something unexpected. Not just less knee pain, but more confidence while walking. Their stride feels steadier. The ground feels more solid under them. That isn't coincidence. That's what happens when the hip finally starts doing its job again. We've now rebuilt the foundation from multiple angles. But there's one movement, something you do dozens of times every single day, that has been quietly draining your knee strength without you ever realizing it. And turning that one movement into an exercise changes everything. Exercise 5. Sit to stand with slow eccentric lowering. The most important movement in daily life, turned into your most powerful exercise. There is one moment that tells me more about a patient's knee health than almost any imaging or clinical test. I don't need an MRI. I just watch them sit down. Not stand up, sit down, because the way a person lowers themselves into a chair reveals exactly how much functional strength they actually have versus how much they've learned to compensate for what they've lost. If there's a controlled, deliberate descent, weight distributed evenly, movement smooth and unhurried, the muscles are doing their job. If there's a drop, a grab for the armrest, a kind of controlled fall where gravity does most of the work, that's the body telling a very specific story about what needs attention. Most people focus on standing up as the hard part, and it is hard, but sitting down slowly is actually the more demanding movement, and it's the one that builds strength faster. Here's why. When a muscle lengthens under load, what exercise scientists call eccentric contraction, it generates significantly more force than when it shortens. Lowering yourself into a chair slowly forces your quadriceps, hamstrings, and glutes to work eccentrically under the full weight of your body through the entire range of motion. That is an enormous amount of productive stress on exactly the muscles your knee depends on most. Research consistently shows that eccentric training reduces knee pain, improves joint stability, and builds functional strength faster than concentric-only exercises. And the equipment required is a chair you already own. Here's how to do it correctly. Stand directly in front of a sturdy chair, one without wheels, with your feet shoulder-width apart. Before you begin lowering, engage your core slightly as if you're bracing for something. Then begin to sit down as slowly as you possibly can. Count to 5 on the way down. 4 seconds is acceptable. 3 is the minimum. The goal is that your muscles, not momentum, not gravity, are controlling every inch of that descent. When you reach the chair, stand back up at a normal pace. That asymmetry is intentional. The strength is built on the way down. If you need to use the armrests in the beginning, use them, but try to rely on them less with each passing week. 10 repetitions, 2 to 3 sets, and you can do this anytime, during a commercial break, before dinner, while waiting for coffee to brew. This exercise meets you exactly where you are and grows with you as you get stronger. And when combined with everything we've covered today, it completes a system, not just for reducing pain, but for reclaiming the kind of movement that makes daily life feel like living again, not managing. Bonus point: aerobic movement prescription, the missing ingredient that makes everything else work better. Nobody likes being told to exercise more. I understand that. And I want to be honest with you. If I could hand you 5 exercises and tell you that's all your knees will ever need, I would. But there's a layer to this that goes beyond strength training, beyond flexibility, beyond anything a specific exercise can target on its own. And leaving it out of this conversation would mean leaving out the part that ties everything together. Chronic knee pain is not just a mechanical problem. It has a significant inflammatory component, meaning your immune system is actively involved, producing chemicals that irritate the joint lining, increase sensitivity to pain, and slow down the tissue repair process. Strength exercises address the structural side of that equation. But aerobic movement, the kind that raises your heart rate and keeps it elevated for a sustained period, addresses the inflammatory side in a way that nothing else quite replicates. A landmark review published in the journal Arthritis Care and Research found that regular moderate-intensity aerobic exercise reduced systemic inflammation markers in adults with knee osteoarthritis more effectively than anti-inflammatory medication alone. That is not a minor finding. That is a fundamental shift in how we should think about movement as medicine. The practical question is always what kind, how much, and how hard. The answer is more forgiving than most people expect. You do not need to run. You do not need a gym membership or a pool or any equipment at all. What you need is 30 minutes of movement that raises your heart rate to a moderate level, roughly 50 to 60% of your maximum, on most days of the week. To find that target range, subtract your age from 220, then multiply by 0.5 and 0.6. If you're 65, that puts your target zone between approximately 77 and 93 beats per minute. At that intensity, you should be able to hold a conversation but not sing comfortably. That's the zone where the anti-inflammatory benefits are most consistently documented. The best options for arthritic knees are low impact by nature, stationary cycling, walking in a pool using an elliptical, or simply walking on a flat surface at a brisk pace. What matters most is not which one you choose. It's that you choose one you'll actually do again tomorrow. Consistency over intensity, every time, without exception. The 5 exercises in this video build the structure your knee needs to move without pain. Aerobic movement is what keeps that structure nourished, resilient, and capable of carrying you through the years ahead. Not just this week, but the next decade and beyond. Important warning. Before you start, 3 things I need you to know. I want to take a moment before you begin because this part matters just as much as the exercises themselves. First, some mild achiness during the first 1 to 2 weeks is completely normal. When muscles that haven't been properly activated in years are asked to work again, they respond. That low-grade soreness you might feel the next morning is not a warning sign. It's adaptation. It means the process is working. Second, there is a specific kind of pain you should never push through. Sharp pain that comes on suddenly, pain that causes your knee to swell, or any sensation that feels fundamentally different from general muscle fatigue. If that happens, stop immediately. Rest the joint, apply ice for 15 to 20 minutes, and contact your doctor before continuing. Your body is giving you important information, and ignoring it will set you back further than rest ever would. Third, if you have had a total knee replacement or any knee surgery within the last 6 months, please do not begin this program without clearance from your surgeon or physical therapist. Some of these movements may not be appropriate for where you are in your recovery, and that conversation needs to happen first. These aren't disclaimers. They're the same things I tell every patient sitting across from me in my office. Final takeaway. This is where it starts. Your knees are not beyond help. They are not a lost cause. They are asking for the right kind of attention, and now you know exactly what that looks like. The difference between people who stay mobile, independent, and active into their 70s and 80s and those who don't isn't luck. It isn't age. It's whether they decided to show up consistently for their own bodies. You don't have to do all 5 exercises perfectly today. Start with 1. Do it well. Do it again tomorrow. That's not a small thing. That's how every real recovery begins. Quietly, deliberately, 1 repetition at a time. Final synthesis. The next 3 years begin today. Here is the truth I share with every patient before they leave my office. The body you have at 70 is largely the result of decisions made at 62, 63, 64. Not dramatic decisions, small ones. Whether you moved or stayed still, whether you addressed the early warning signs or waited for them to become something harder to reverse. Knee pain that feels manageable today has a trajectory. Left unattended, it quietly reshapes how you walk, how you sleep, how confidently you move through the world. It limits you in ways you won't fully notice until the limitation is already significant. But that trajectory is not fixed. The research is unambiguous on this. Consistent, appropriate movement genuinely changes outcomes. Not metaphorically, but measurably, clinically, in real patients with real arthritis living real lives. 1 year from now, you will either be stronger than you are today, or you will have drifted further from the mobility you still have right now. There is very little middle ground after 60. You have everything you need. The only question that remains is whether you'll use it. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.